we have in conventional medicine so many different specialties. As you just mentioned, it isn't a Costco. It's a very niche, small store, and you could only provide so much. And most of that is actually not empowering patients. It's actually telling them, take this pill, we'll see how you feel, and then go on from there. And a lot of that is dysregulating autonomic nervous system, actually. They're doing a disservice to it. Do you think that the only model this could work in is a model such as your own, or such as one that's outside of the conventional realm right now?
Good question. So I see the business of sickness over here, and they're really good with trauma, infections, broken bones, heart attack, strokes, the acute care situation. But the business of sickness is also trying to be good at heart disease and diabetes and obesity and autoimmune disorders and sleep issues and mental illness. And the stats of that are not showing progress. It's just a lot of medications being thrown, nothing being taught. So you're not going to change that system. What I found as a chiropractor, sometimes the last resort, people need to leave that system and find the healthy options over here and use this system in the acute care situation they need, and go to practitioners who are out there who could help them improve their body's performance on the inside so they could better handle stress from the outside. And I tell patients they can't wish for health. You should plan for health. Much like a financial plan, you have to have a plan to take care of your body as you continue to age. And what happens is people age, Casper, mentally you actually feel younger, but physically people feel older. So you have this disconnect between the mind and body. And there's ways that what people typically do is they take medication to try to get this connection to happen, to have this youth with experience. Everybody wants youth with experience, but they don't have a plan for it. They wish for it. So there's ways, if you kind of take care of your body and flexible and eat right, stay off sugar and gluten and dairy and bad vegetable oils, right? The thing is, if you could take care of your body, there could be less of this disconnect, so you can actually enjoy your life. And what you're getting is more time. And if you could get more time of being in your 70s and 80s and go for hikes, you're living a happier quality of life with less breakdowns, because you can't buy back that time. So if you plan for it, you're going to get more time to enjoy your life, less breakdowns, happier, and you're able to do things and fun activities that you love to do. So unfortunately, the system doesn't really teach that.
No, I totally agree. And I want to go into that a little bit more, because you're right. I think as you age, and nowadays I think people age very young. We see 20, 30-year-olds come into our clinic that probably resemble more 50 to 60-year-olds physically. And of course, the opposite goes too, where you see a lot of people that are in the older age just can't do things and have the wisdom and the mindset of a 30-year-old in a sense. But, also, I think vitality is a big part of it. And that's why we say it's not that patients can't be good athletes. It's sometimes they're just not in the position to be an athlete at all where they are physically.